When it comes to using Epirubicin HCl vial, it's important to know that this medication is administered through an injection into a vein by a healthcare professional, following your doctor's instructions. The dosage will depend on your medical condition, body size, and how you respond to the treatment. If the medication comes into contact with your skin, it's crucial to wash the area thoroughly with water. You can also use soap and water, or a mixture of baking soda and water. In the event that the medication gets into your eye, it's important to flush your eye with water for 15 minutes and seek medical help immediately. While using Epirubicin HCl vial, it's recommended to drink plenty of fluids, unless your doctor advises otherwise. This can help reduce the risk of certain side effects, such as increased uric acid levels. Remember to always follow your doctor's instructions for the best results. Some common side effects of Epirubicin HCl vial include nausea, vomiting, diarrhea, abdominal pain, flushing, or changes in skin/nail color. Your urine may turn reddish, but this is a normal effect of the drug. Temporary hair loss is also common, but hair growth should return after treatment. Remember that the benefit of this medication outweighs the risk of side effects for most people. However, if you experience severe side effects such as unusual bleeding/bruising, or signs of dehydration, contact your doctor immediately. It's important to take steps to prevent dehydration and to lower your risk of side effects due to the rapid destruction of cancer cells. And as always, if you notice any serious side effects or signs of a serious allergic reaction, seek medical help right away. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. Before taking Epirubicin, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This medication may increase your risk of infection, so it's best to avoid close contact with anyone who has a contagious illness. Additionally, it's important to be cautious with sharp objects and to avoid activities that could result in injury. Epirubicin may also make you more sensitive to the sun, so it's best to limit your time outdoors and use sunscreen. If you are planning to have surgery, be sure to inform your doctor about all the medications you are taking. It's important to note that older adults and children may be more sensitive to the side effects of this drug. This medication can also affect menstruation and may cause premature menopause in females. If you are pregnant or planning to become pregnant, it's crucial to discuss this with your doctor. Epirubicin can harm an unborn baby, so reliable forms of birth control should be used during treatment and for a period of time after the last dose. It's also important to note that it is not recommended to breastfeed while using this medication. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Epirubicin HCl vial include cimetidine, trastuzumab, and anthracyclines such as doxorubicin. Be sure to inform your doctor of all the medications you are taking, to ensure the safe and effective use of Epirubicin HCl vial. Remember to follow your doctor's guidance regarding the daily dosage and the optimal timing for taking this medication. If someone has taken too much Epirubicin HCl vial and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical help by calling 911. Alternatively, you can also contact a poison control center for assistance. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for guidance. Before starting Epirubicin HCl vial, it is important to undergo lab and/or medical tests, such as complete blood count, liver/heart function. These tests should also be done while you are using the medication. It is important to keep all medical and lab appointments. Consult your doctor for more details on the specific tests that may be required. Remember, it's crucial to take each dose of Epirubicin HCl vial as directed by your healthcare provider. If you happen to miss a dose, be sure to contact your doctor or pharmacist immediately to establish a new dosing schedule. This medication is typically administered by a healthcare professional in a medical setting, so be sure to follow their instructions carefully. Epirubicin Hcl Vial is used to treat various types of cancer, such as breast, lung, and ovarian cancer. The dosage and timing of the medication will depend on your specific medical condition, so it's important to follow your doctor's guidance. Be sure to ask your healthcare provider about the best time to take this medication and any potential side effects you should be aware of. This medication, Epirubicin Hcl Vial, is typically administered in a clinical setting and should not be stored at home. It is used to treat various types of cancer, such as breast, lung, and stomach cancers. The dosage and timing of administration will depend on the specific type of cancer being treated, as well as other individual factors. It is important to follow the instructions provided by your healthcare provider and to attend all scheduled appointments for the administration of this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.